Well, welcome back to Great Day St. Louis. Dr. Eric Falconer from the Youthful Body is here with us this morning. Now, you've shown us what the Zerona laser, I believe it is, can do and how the body jet can trim inches from your problem areas. We've talked about that before on Great Day St. Louis. Today, something a little different.
Yes.
Now, we have joked, I have joked on Great Day St. Louis about back fat. Being the owner of back fat. But what you do with the back fat, we're talking natural breast augmentation. Tell me what happens.
Well, with natural breast augmentation, what we do is we combine the top two cosmetic procedures, which are breast augmentation and liposuction. And what we do is we augment the breast by transferring the patient's fat from a problem area to an area of the breast.
So I understand that the fat that is, and the word is harvested, is undisturbed. Is it in other procedures? I don't even know what that means.
Well, what that means is we utilize the body jet, which is the most gentle liposuction equipment, and therefore the fat comes out, it's still living fat cells, and we can transfer them to other areas of the body, such as the breast. And
is that all done in the same procedure at the same time, same appointment?
It's done during the same procedure, absolutely.
And so we're not talking implants then?
No.
And so that would lead me to believe that you have less scarring, less pain. Am I right?
Absolutely. The very small incisions, we're talking about an incision that's maybe ½ a centimeter or less in each breast, and that allows us to do the grafting of the fat to the breast area.
And talk about downtime then and the pain. There's a lot of pain generally we hear with lipo and breast implants.
Well, with the body jet, there's minimal discomfort, and also with the fat transfer, the micrografting to the breast, there's going to be minimal pain also. So most patients are back at work within 48 hours.
Wow.
Yes.
Is there an ideal candidate for this procedure? These two procedures, I should say?
There are ideal candidates. Well, first of all, you need to have sufficient, stores or amounts of fat on your body so we can take that fat and harvest it and transfer it to the breast. The other thing is we want to make sure that you have a very low risk of breast cancer. So all patients undergo a preliminary mammography, which has to be normal. And the third thing is you need to be within 2 cup sizes of your desired breast size. So, for instance, if you're an A, you want to go to a D, you might not be the best candidate. But if you're within 2 cup sizes, then you're a great candidate for it.
Is that because we're only going to get so much? We're only going to be able to harvest so much?
Well, not initially because of harvesting, but because of there's only a certain amount of volume that you can place in the breast from the beginning stages. Yes.
And I'm over here. So many things are going through my head right now, as you know. When you said that you have to have enough, if I can pinch it up, I mean, how does one know at home that they have enough back there that can then come here?
Well, pinching, of course, is probably
You're handling me so well today.
The most common way. I mean, definitely, if you can pinch a handful of fat, then you probably have enough. But we harvest it, like you said, from the back is a common area. The waist, the abdomen is definitely a common area, but also the thighs. Saddlebag area is a very common area, and that's actually one of the most, I'd say, one of the better fat areas, believe it or not.
And the benefits, we've already talked about downtime, very small incision. I mean, those are obvious benefits.
That's obvious, but things that you might not think about are the feel. So you have a natural feel to the breast as opposed to a saline implant where you lose some of that natural feel.
Right.
And the other thing is you get a natural look. So you get the natural cleavage, which is towards the center, whereas a lot of times with breast implants, they're going to be more lateral, more outward, and then you kind of force it, get a bra to push them together to give you that natural cleavage in the center. I
hugged a woman one time, and I thought, it hurt. And I found out later they were implants.
Absolutely.
So a more natural feel and look would, be great for not hurting us.
Right. But another candidate would be a woman who has already had implants. We can place the fat above the implant. For instance, if she's had them for several years and she doesn't like them, or there's some asymmetry, or sometimes you can get rippling because of the weight of the implant.
Right.
Well, then you can go and touch that up with the woman's fat so that she can get more cleavage and she can hide imperfections of the implant.
You can be blood donors. Can you be fat donors?
No.
Darn! Darn!
That was my question.
I was ready, man. I was going to tear. Let me help another woman out. Thank you, Dr. Falconer.
You're welcome.
I hope I've done you justice.
Absolutely.
I don't mean to joke, but I do mean to joke. If you're interested in finding out more about this incredible thing, breast augmentation, or about BodyJet, contact Youthful Body at the number on your screen. I know a lot of you are interested. Make this call, 314-692-2639, or check out their website at theyouthfulbody.com. Matt, Kent, I mean, this is amazing.
It is. Well, and it's the holiday season. It's the season for giving. I think it's only
But
fair.
I can't give. I can't give like I want to give.
It's not like a kidney. You can't
No,
do that.
no. Where is the medical science when I need it?
All I know is there's going to be a lot of sore arms tomorrow after people reaching around. See, can I pinch?
Can I pinch it?
Do I have
Can
enough
pinch it?
back here?
No, you just do that. You just do
That's
this.
right.
Just take
There
it
you
back.
go.
Yeah.
Thank you very much, guys. Next on
So
Great
many
Day.
jokes,
I
so
know.
little time.
We've only got an hour.